Good morning, hires. Today we're going to look at the second part of Unit 2, Key Area 7, pathologies of cardiovascular disease, clotting and thrombosis, and the effects this has on the human body. Our aim today is to learn how issues in clotting and blood supply can lead to damage to the tissues. So a learning outcome would be to learn about normal clotting and then how that clotting can damage the tissues of the body. So think at home, you cut your arm. How does your body deal with this? So you have an open cut to the outside world and it is bleeding. How does your body deal with it? So you might have thought for this one, well, I cut my arm, it bleeds, I put pressure on it, or hopefully you put pressure on it, and then it clots. I end up with a hard thing formed over that cut. If it's quite a large cut, you can get quite a big scab. And then over time, the scab falls off, and underneath my blood, having clotted, has replaced the skin. A clot blocks the blood flow to an area of the lung. What is going to happen? Okay, so if you imagine the thing that happened previously on the outside of your body happens inside your lung. This isn't quite how clots tend to form in the lungs, but if we follow this through for the moment, so if you have one of these blood clots in your lungs and it's in the blood supply to an area of tissue, you can imagine the blood coming along, getting to the clot and not being able to get past it. Any of the areas after that clot that are supposed to be perfused with the blood, so that are supposed to get the tissue fluid from the blood plasma, are not going to be able to get it. Those tissues will be starved of oxygen and could die. So this is partly what causes something called a pulmonary embolism, not quite, but mostly, and it can lead to really, really nasty things happening. So when you cut yourself, your body releases clotting factors. This may seem really, really simple, but this actually gets quite complicated. So this is the process that you need to know for the higher human course. You cut yourself, your body releases what are called clotting factors. So in a flow chart, first thing, damage releases clotting factors. These activate what's called a cascade. So a cascade, one thing sets off another thing, sets off another thing, sets off another thing. So the clotting factors set off a cascade of reactions which converts the enzyme prothrombin to thrombin. So clotting factors are released because of damage. This makes the inactive form of the enzyme, which is called prothrombin, become the active form thrombin. So the conversion of the enzyme prothrombin to its active form, you can think about Clark Kent becoming Superman. The thrombin then causes molecules in your plasma protein called fibrinogen to form threads of fibrin. So again, clotting factors cause prothrombin enzyme to become thrombin. The thrombin enzyme can then turn proteins called fibrinogens in your blood plasma into fibrin. So fibrin is what gives you this big fibrous mess of red blood cells and other stuff that gives you a scab. So clotting factors, prothrombin to thrombin, fibrinogen to fibrin. So fibrinogen is soluble, so it just goes around in the blood. When the enzyme thrombin makes it into fibrin, it becomes insoluble and would precipitate out, really, would not dissolve into the blood, and it will develop this clot. So it's quite a cute little system. If you damage the outside of your body to turn to activate this cascade and to prevent bacteria getting in and blood leaking out. The fibrin threads form a meshwork that clots in the blood. It seals the wound and provides a scaffold for the formation of scar tissue. So it quickly covers the area and helps your body to form skin over that area. If it's a small cut, you might get away without a scar. If it's a larger cut, your body isn't able to program the cells properly to cover it. So clotting can also happen inside your body. So we've talked previously about atheromas. So soft cholesterol is put under the endothelial lining of the blood vessel, and that's fine. But over time, you're building up, it seems over the course of decades, you're building up this cholesterol underneath the lining. And as you're doing that, your body then adds more fibrous, hard things. Cholesterol is quite soft, but fibrin, we've just talked about, is quite hard. That forms underneath the endothelial lining. And with the movement of blood over the top of that endothelial lining, you can get a cut. So you can get the fibrous bit poking through that wall of the endothelium. So then the atheroma, this clot, a plaque thing underneath this plaque underneath the endothelial lining has caused damage. Your body does what we've just talked about, being really good. It tries to use prothrombin to thrombin, fibrinogen to fibrin, and tries to fix the issue. The issue is you don't really want a blood clot inside one of your blood vessels. You've now completely occluded that artery or that vein. So this area here was already quite narrow because of the plaque. The clot that you've now put on top of it is completely covered over that area. So blood is not able to get past that. As we talked about before, that means all the areas that are supposed to be getting blood after this are not getting blood. That means they're not getting oxygen, they're not getting nutrients, and they may start to die. So this is just a wee diagram to show you. So we've got the formation of a plaque of atheroma, cholesterol, fibrous stuff underneath the endothelial lining. We can see damage and a blood clot, a thrombus. So the blood clot that is staying where it is called a thrombus. It can cause lots of nasty things because it cuts off the blood supply after it. It's only really when it goes on the move that it starts to damage other parts of the body. So there's a difference between thrombosis and embolisms. So a thrombus, singular, is a clot within a blood vessel. If a bit of that clot breaks off and moves around the body, it's called an embolism. So there's lots of things that can cause embolism. Fat, air, these blood clots can cause embolisms. You may have heard of deep vein thrombosis. So DVTs are when the veins in your leg get one of these big blood clots, and that means the blood can't get past that clot, and the vein starts to become very big and bulbous, and you can quite often see these big veins on the outside of someone's body. If the embolism moves round, it goes round through lots of big blood vessels until it gets stuck. So if we think about there being a thrombus in the leg, so there's one of these blood clots that have happened in one of the veins in the leg. Where does the blood go after that, though? So a bit of the clot up here breaks off. It travels up. Using our knowledge of biology, it goes up, goes in through either the inferior or the superior vena cava, and it goes into the right atrium. Vena cava is big, biggest vein in the body. Goes into the right atrium, pretty big. Right ventricle, pretty big. Out through the pulmonary artery, pretty big. We're doing okay. Nothing's gone wrong so far. Whizzes round. Where is the next set of capillaries it's going to hit? That is the tiny blood vessels of the lung. So a deep vein thrombosis, which can be exacerbated in some people in pregnancy, can cause something called a pulmonary embolism. So a bit of the clot's broken off, it's whizzed round, gone through the vena cava, through the heart, and then the first set of small blood vessels it gets to are the capillaries of the lungs. So that means the blood supply to part of your lungs cut off, and it's really, really sore. That part of the lung will start to die. If you get one of these blood clots getting through that, goes into the heart, and it'll come out the aorta. It will then whiz round again until it finds a small capillary bed. One of the capillary beds it quite often goes to is in the coronary arteries. We'll talk later about myocardial infarctions, MIs, but if you get one of these clots in your heart muscle, it can kill heart tissue. So an embolism, here we go. This is someone's aorta. I think this is very, very disturbing. This is a massive clot in this person's aorta. In some cases, a thrombus, either blood due to damage or a piece of the atheroma, will break loose and form an embolus or an embolism, which travels around the bloodstream until it blocks a small artery. This doesn't just cause pulmonary embolisms, which is the lung issue, doesn't just cause an MI, so what people would generally think of as a heart attack. It can cause things like ischemic strokes. So again, if it blocks a small blood vessel that's supposed to be perfusing the brain with blood, then that part of the brain after that does not have blood. And obviously your brain likes blood, so you will get damage to the brain tissue, which is not amazing. So that's what's called an ischemic stroke. You get bleedy strokes and you get clotty strokes. An ischemic stroke is a clotted stroke where there's a lack of blood getting there because of a clot. So blocked blood vessels can't perform their functions and tissues are deprived of oxygen, leading to death of that tissue. A thrombus in the coronary artery may lead to a myocardial infarction, which is what most people know as a heart attack. This PowerPoint was made in about 2015 when Ryan Gosling was a much bigger thing. So a thrombus in an artery in the brain might lead to a stroke. So a thrombus in the coronary arteries may lead to a heart attack, an MI, and then we talk about it leading to a stroke. So think about this question here. During clot formation, thrombin, what does it do? So it's always easy to think clotting factors, prothrombin to thrombin, fibrinogen to fibrin. And if you remember clotting factors, prothrombin, thrombin, fibrinogen, fibrin, it kind of brings you through. The first one's an enzyme, the second one is the mesh. So thrombin, nope, so prothrombin forms thrombin, so that's not right. Causes the formation of fibrin, so thrombin does cause fibrinogen to become fibrin, so it might be B. Causes the release of clotting factors, no, that's the thing that causes prothrombin to become thrombin, these clotting factors. Forms the meshwork that clots the blood, no, so that's the fibrin fibers here. So thrombin causes the formation of fibrin threads by causing prothrombin to become thrombin. Describe what causes an ischemic stroke. So ischemic strokes, checking if the answers came up. An ischemic stroke is caused when an embolism or blood clot travels round and reaches one of the small arteries perfusing the brain with blood. It blocks this artery and prevents the blood from providing nutrition to the tissues of the brain. The brain is then damaged and this causes symptoms of a stroke, which you might know as fast, face, arms, speech time. So peripheral vascular disease is the narrowing of the arteries due to atherosclerosis of arteries other than those in the brain or heart. You may not know that you have the condition. Symptoms include things like pain or cramp in your calves, or less commonly in your thighs, buttocks, muscles, or feet. The pain will come on after walking or doing other exercise as oxygen supply to the cells will be restricted. So peripheral vascular disease is the kind of the vasculature, the blood vessels, not in your central part, not the bits that do your organs on the inside of your body. So not the heart and the brain, the other stuff, arms and legs usually. The arteries of the legs are most commonly affected. Pain is experienced in the legs due to a limited supply of oxygen. A DVT, or deep vein thrombosis, is a blood clot that forms in a deep vein, most commonly in the leg. It can break off and result in a pulmonary embolism in the lung. We've talked about how that happens. A bit breaks off, goes vena cava, right side of the heart, into the capillaries of the lungs, cuts off blood supply. Nasty. So, you should be able to explain with reference to atheromas why a clot might form in an artery. So the cholesterol build up, then the kind of scaffolding with the fibrins, and then that breaking through the wall of the endothelial your body, causing clotting to happen. So releasing clotting factors, prothrombin to thrombin, fibrinogen to fibrin, you've got a clot. An embolus is a thrombus that is on the move. So a clot on the move is an embolus. Describe what happens when a thrombus occurs in the coronary artery and in the brain. In the coronary arteries, so these are the arteries that supply the heart muscle with blood, it would cut off blood supply to any area of the heart muscle after that thrombus, after the clot. And that would cause damage or death to the tissues. Similarly, in the brain, the thrombus cuts off blood supply to part of the brain. This will cause an ischemic stroke. Again, I'll put up textbook questions page 180 to 181, and you can answer the following questions. What are the peripheral arteries? You might already know from the PowerPoint, they are the arteries that do not perfuse your brain and heart. So everything else. And give a brief description of 2 peripheral vascular disorders. Okay, in the next video we will look at cholesterol levels.